Now we talked about metaverse, and that was actually a great segue with the keynote speech, the first keynote speech as well. And of course, we have to be careful about data privacy. And we talked about the digital twins and the individual and personal data that are accumulated because of the digital twins. So now we will talk about a sector where data matters. The topic of session 2 is the future of digital healthcare, and this is co-hosted with Digital Healthcare Partners, which is a startup investor in the field of digital healthcare. We will look at the new technologies and the concept of digital healthcare and the new technologies in the post-COVID digital healthcare era. We will look at topics such as telemedicine as well as digital therapy. I look forward to great insight into the topic. Now let me introduce the speakers. This session will be moderated by Managing Partner Choi Yun-sub of Digital Healthcare Partners, the co-host of this session. We also have with us Country Manager Kim Young-in of Noom Korea, Chief Medical Officer Kim Soo-jin of AIMMED, and CEO and founder Choi Do-ah of Hooray Positive. Thank you for the introduction. We'll now begin the second session titled The Future of Digital Healthcare. As I've been introduced, I am the co-host of this session. I'm Yun-sub Choi, the managing partner of Digital Healthcare Partners. And the MC well summarized the purpose of today's session. Especially since COVID-19, digital healthcare is really the center of the world's attention. And today we'll discuss why people are so focused on digital healthcare and what is the future that we are trying to shape. And this session will last for about an hour. And once again, I would like to briefly introduce the panelists, what kind of a background they have, what kind of work they're doing. On my left, I have so when I call your name, please introduce your name, your affiliation, and also your work. First, from Noom Korea, we have the CEO of Young-in Kim.
안녕하십니까.
Good morning, everyone. I am the managing partner of Noom Korea and Noom Japan. My name is Kim Young-in. I majored in medicine, and my initial goal was to become a doctor, but now I work in the business sector, and I at Noom we look at the research and development area of the healthcare sector. Can you please tell us more about Noom? Well, Noom first started off in the US, and we provide a mobile platform app for weight loss, and we integrated AI and humans so that we can help people prevent diabetes and lose weight, as well as other services.
용어로 한국계
For your information, I call it I think it's the only Korean unicorn startup in digital healthcare that started in the States. And we have Soo-jin Kim from AIMMED. Hello, everyone. My name is Kim Soo-jin. So I'm a psychologist, and we also have many different paid models. We provide digital healthcare services, and for instance, for the employees in companies, and we also provide digital therapy and B2C business models and senior platforms from insurance companies. And based on my own experience that I interacted with the patients, I supervise all the clinical trials. And these days, digital therapeutics are being developed by AIMMED as well. And last but not least, on the far right of myself, we have Choi Do-ah, the CEO of Hooray Positive. Hello, I am Choi Do-ah from Hooray Positive.
Our company is aimed at providing everyday tools to manage chronic diseases of patients. It was founded about 12 years ago, and we worked very hard on this front of digital healthcare to really pioneer this field. And in the beginning, we were focused on health management service of chronic illnesses. That was how we began. And now we are more focused on making everyday innovations in patients' health management. That is the future that we are trying to design for ourselves, and that is where we are focusing our energy on. And personally speaking, to introduce myself personally. May I introduce myself personally? Yes, of course. So at first, I wanted to just build a startup that survives. That was my goal, and I wanted to lead a startup that kind of flourishes and survives. But in the future, my vision is to actually shape and suggest the future direction of digital healthcare industry in Korea, and I want to make a contribution to the industry of Korea. And that is the vision for myself personally, and that is how I am kind of changing the definition of myself and my work. That was my introduction as well as my company's introduction. Thank you. Thank you. So as you can see from our panelists, well, actually, to introduce myself, I am a managing partner of Digital Healthcare Partners. It's basically a startup accelerator in digital healthcare industry. And as you can see, myself as the panelist, we try to bring a balanced mix of the panelists. So there are startups that are getting the investment. There is the accelerator that's investing in startups. We have two healthcare professionals. We have two non-healthcare professionals. So we will be able to address a lot of different perspectives and angles in terms of the digital healthcare and its future. First of all, I would like to ask this question to you. Now, this forum has been hosted by the Ministry of Economy and Finance, so I think that's why we have to really pose this question. I'm sure that many people heard the word digital healthcare, but not a lot of people have a clear definition of what that means. So why don't we just begin by defining what digital healthcare is from your own perspectives? Who would like to go first? Anybody would like to volunteer, maybe?
I'll go first. Well, in fact, well, Mr. Che, you gave a lot of lectures and you're like the ambassador of digital healthcare. But well, the scope of digital healthcare is so wide. So we need to make some segmentations of the sector. The reason why I wanted to speak first is because our company focuses on digital wellness, which is a small segment of the digital healthcare sector. So I would like to talk about that segment. Of course, we have different segments in the digital healthcare, but when it comes to wellness, this term existed for a very long time, but now we link that to mobile as well as a digital medium. So that's the definition of digital wellness. So there is one famous company in the US, which is called Peloton. So people used to cycle at home or in the neighborhood, but now what happens is that you can watch the lessons from very popular cyclists at home, and you can train with them. So that's how we connected the digital area to the real life. So it's not like it's a breakthrough therapy that we introduced. But of course, we have a lot of knowledge about weight loss, such as, you have to reduce intake of calories, you have to exercise, and you have to, follow certain routines. And everybody knew that. But now what we do is we provide that in a very orderly manner in our application. And all the series of activities in our app, that's part of digital wellness. So, meditation, you have fitness, you have weight loss, as well as different concepts related to digital wellness, and we provide those services.
은 디지털
Thank you. In digital healthcare, you explained with the focus on digital wellness. And because digital healthcare is such a big domain, there are a lot of other areas. So, Sujin Kim, what about the medical aspect of digital healthcare?
밖에서
So, outside the hospital, it's wellness. Inside the hospital, that's the healthcare services, the traditional healthcare services. So that concept involves the suppliers as well as those in the demand side, but there is an imbalance between the two. So for instance, what I mean by that is the care is provided, or the type of treatment is decided by the doctor, not the patient. So of course, from diagnosis to treatment to follow up, all the different cycles are part of the healthcare service. But now what happens is that the current healthcare focuses on diagnosis and treatment, because when it comes to prevention and management, that's not part of the current healthcare sector, because it's not covered by the insurance. So with the digital transformation, we see more data of the patients, and now what happens is that the patients now have the power and control over their own data. So the power shifted from doctors to patients. And with that, we want to address some of the challenges in the industry, so that we can provide high quality healthcare services to the patients, because we are entitled to such rights.
기존의 의료
Yes, the conventional medicine focused on diagnosis and treatment, whereas in the digital era, we will see the expansion of medical services to cover prevention as well as post-treatment management. And in that process, we will have better engagement of the patients as well. And Tua Che, do you also have something to add to that? Yes. So I think I would like to summarize what these two panelists have said. So I would like you to visualize a map in your mind. The x-axis would represent the prevention, diagnosis, treatment, and operation and rehabilitation, or hospice experience of the end users or the patients, so the transfer across these experiences. And the y-axis would be the entities that provide these services, like health insurance companies, hospitals, local authorities, hospices, and other healthcare service providers. And where the x-axis and the y-axis meets would be where you map the service, and that would illustrate the digital healthcare services that are provided to the end users as of now. And you will notice that most of these services as of now are analog, and on the other side, digital healthcare services would have to have a data processing capability by breaking down these different stages that the patients or the end users go through. And if you look at the different points in time and the different points of service, you have to figure out which part is digitized, which part is not digitized. And when you identify that gap, you can learn where to digitize in order to create added value. And from that point of view, you will understand why it's so important to digitize healthcare. Because if you think about commerce or finance or other industries, we already have a high level of digitization. However, in healthcare, it's still dominantly analog rather than digital. And that is why digital technologies and digital data processing have a lot to do for the healthcare industry. It can actually create a lot of value in healthcare industry, because it's kind of an untapped market. It's more of a promising market when it comes to digital technologies, and that's why I'm very excited to see many more digital innovations in the field of healthcare. Thank you. Tua Che, when I met you personally, you told me this, which was impressive. You said that digital healthcare was is a planned future that will 100% come about. It's not an if, it's a when. And I would like to give you some examples of that. Recently, there are a lot of discussions on telemedicine as well as using AI to read x-rays and medical images. And also, we can use VR or metaverse or blockchain technology to provide healthcare services. And there's a lot of potential there to create added values. That's basically the idea of digital healthcare. I have prepared 3 questions for you today. The first question is, as I told you in the beginning of the session, one of the reasons why people are so focused on digital healthcare is because of COVID pandemic. We are all wearing facial masks. We have these silos between us. After the pandemic, we have had so many changes unfolding in the digital healthcare industry. And I would like to know what you found the most interesting or impressive in terms of the changes in digital healthcare. Youngin Kim, why don't you begin?
그
Yes. With the outbreak of the virus, the major change that we faced was the acceleration of everything that used to happen before. So somebody said that we are experiencing 2025 because of the pandemic. So the pandemic accelerated the trend, and this will become the norm in the future. Well, at least that was what we had expected before, and it actually became the norm. So Korea did not experience lockdown, so the impact was not that huge. But when it comes to Europe and the US, lockdowns caused fitness centers to shut down, and people had to stay home. They could not go outside. That's why they had to rely on mobile apps to lose weight and to exercise. So we saw a rising demand in those services. And now, the services, the conventional ones that we used to provide, now moved online. And regulations as well as usage of those applications are also on the rise. Now, this is a type of investment for the future. I think before we used to see this future as something we have to achieve in the near future, but now it has become reality. So I think the major change is that the patients and the users can actually feel the assets. So what I mean by that is we call experience asset. So you have to experience something to know how good that is. So before they had to spend actual money, but now because of the pandemic, now everybody can access digital healthcare and get a glimpse of what digital healthcare is like. And now the experience can evolve going forward.
Yes, because of COVID, a lot of the barriers actually went down, accelerating changes in digital healthcare. And the public now have much more access and much more experience of digital healthcare because of COVID-19. And next, Sujin Kim.
네, 비슷한 얘기는
Yes, I would like to echo what Mr. Kim said. So yes, scalability and experience are the two themes that emerged. So of course, the conventional healthcare sector did not collapse because of the pandemic in Korea. I think we fared quite well. But then when you turn your eyes to other countries, the traditional healthcare sector faced huge challenges. And because of that, they moved to telemedicine faster than expected. Now, of course, you may think, well, this is something that you need to get involved into in-person consulting or meetings. Or for instance, sometimes, when if you think about it, in the future, you may have like remote meetings with your, future parents-in-law, and our life will change going forward. So I think now we are on the same page regarding those changes.
산업
Yes. Overall, we have had growth in any contactless activities across different industries. And telemedicine or contactless medicine also is growing on a global level. And also, a lot of countries like the US have actually eased the regulations on telemedicine. And so we see growing acceptability of the telemedicine. And next, to Ache, what do you see as the biggest change? Yes, I agree with what they've said. I think what's the most important is that we've seen changes in norms. When we discuss any new industry, we think about, is it effective? Is it profitable? Does it give enough ROI? Does it have too many regulations? Well, we basically skipped all of those questions because of COVID, because these questions are now meaningless in the face of COVID-19. And so digitization of healthcare is the only way forward for us now. And also, people realized how valuable health is. And these two messages or the basically lessons we learned through COVID-19. We had a blank canvas before COVID-19. Now we kind of have an inevitably full canvas. And so this industry of digital healthcare will continue to grow stronger in the future. And in Korea as well. Now the consumers, the end users, know that this is the way forward because they've got a taste of it during COVID. And so at the industry level, we will see growing markets. We will see such great products and services continuing to be launched. Great. Yes, you talked about norms. So norms would refer to something that you think is normal, and that has changed because of COVID-19. And we were actually able to skip so many different barriers and questions that come with any new industry. Thank you for your meaningful answers. And the second question is, actually, I am watching the YouTube chat in real time to read the real-time questions by our audience. And what do you think is the most promising in digital healthcare? We talk about digital therapeutics, metaverse, AI, telemedicine, and etc. Because you are actually working in digital healthcare, I'm sure that you have your specialty. But regardless of what your specialty is, what do you think is the most promising sector or theme in digital healthcare? Young-in Kim?
아무래도 저희가
Well, we are most focused on, of course, this might lead to disagreement, but this is my personal take on that question. Well, Ms. Kim talked about the digital transformation and that the patients and users have now become the leading agent in controlling their own data. And I think that's very significant, especially when you think about information asymmetry when it comes to insurers as well as other providers. Now they held the data of the patients, but now patients can claim their rights over their own personal data. And I think that is a very definition of digital transformation. And of course, digital healthcare is a very technical area. So as I mentioned, the wellness can actually serve as a gateway between digital healthcare to the patient. So it can act as a segue into the patients. So what I mean by that is, for instance, people using smartphones and, taking care of their health with their smartphones or relying on telemedicine to see their doctors. That concept is quite new and unfamiliar. But now, using our mobile app, you can actually get coaching about how to lose weight, and you can also get trained, and you can exercise. And with that, you can get a glimpse of what digital healthcare looks like, and it will help patients, accept the concept of digital healthcare. So we don't really have a digital wellness platform, per se. For instance, for finance and other sectors, we do have such platforms, but not for the wellness sector. So now we can't really say that there is one dominant player in this market. But let's say that we target cancer patients. And then, you can't really, scale that up to all patients. But then if it comes to, diet or losing weight or exercising, that's quite universal. And you can start off with those concepts and then maybe drill down to specific topics. So I think that's one way forward. And of course, Ms. Kim and Mr. Che will talk more about this. But digital therapy and therapeutics is very much different to the conventional drugs. So you have to use apps, to access such drugs. So it's about, UX and UI. It's about providing better user experience to the users and patients. So you have to really have very strong contact points and touch points with your users. And I believe that those will be quite promising going forward.
제가 유튜브로
And I have a few follow-up questions. You said that unlike finance or other industries, in digital healthcare, you don't really have an integrated platform yet. For example, Noom has a platform in its own particular sector, and so do other companies. In the long term, do you think that digital healthcare will see the consolidation into a single platform?
되게 좋은
Oh, that's a very good question. Well, in fact, I think we can only make a deductive conclusion. For instance, like, did the existing players survive with the digital transformation or not? We have to see the results. And I think the results is still open. But what I see as a future is, for instance, like insurance companies now have eased regulations, and we see more data flowing into the digital healthcare. And at the same time, we have our startups in the digital healthcare sector, so one vertical, doing well and performing well, and that can actually lead to more success cases. So I think we have to integrate, the two have to meet halfway. And well, I look forward to an integrated and converged model, and I think that would be ideal. Especially, Korea is better positioned to create such a model compared to other countries because Korea is a strong player in healthcare sector, and we provide great access to not only healthcare but to IT. So by combining the two, I believe that we can strengthen the platforms, and that can go global and survive and succeed in the global market.
통합 플랫폼
Yes, in creating a consolidated platform, I mean, a lot of the insurance companies are actually in that process. And also, there are vertical platforms that could be developed by startups. And I have a follow-up question that we got from YouTube. So there are big IT companies and insurance companies that we could benchmark. And also there are the roles to be played by startups like Hooray Positive or Noom Korea, targeting your special vertical. How do you think that the big conglomerates and the startups can create synergetic effect?
드리면은
Well, so if you travel back before the COVID-19 pandemic, digital startup companies, did not really, it experienced a lot of difficulties receiving investment from big companies. But now after the outbreak of COVID-19, now people are more interested in health, and that was accelerated by the pandemic. And I think that healthcare and education, where we saw a lack of investment, are now receiving more investment because of the pandemic. And I see more opportunities to receive investment. So from different avenues, so we don't need to rely on big companies only. However, healthcare companies can receive investment from the government as well. scale, not just big companies, but it has to leverage, its logistics power as well as its capacity, as well as, the big companies have this strength, and the startups can leverage such strength of the big companies, but we have maybe a stronger upper hand.
Yes, big players like insurance companies, pharmaceutical companies, and governments, they are our subjects of cooperation with the startups, and also it's more advantageous for us to now win investments as startups. And my next question is, so my question was, what do you think is the most promising in digital healthcare? Sujin Kim?
네, 뭐 지금
Yes, as Mr. Choi mentioned, as the moderator mentioned, we develop digital therapies and digital therapeutics, and I think that's quite promising. Not because our company develops it, but because it is very promising. So we are very excited about those developments. So maybe this strategy goes against what Noom is doing. So it's not accessible to everyone. It's not about becoming healthy and losing weight. It's not universal. What we do is very specific, and it targets a very few number of population patients. So we target specific population groups. And we have to have a dual track strategy, because if you think about the conventional healthcare industry, as we said before, commerce or mobility or banks, they provide a very accessible service. However, that was not the case for healthcare. I'm sure that you have a hard time, coming up with a success story in the healthcare sector. So, of course, sleeping and eating, that's part of your everyday life. So we have to provide services that caters to those needs. However, that's not what healthcare services do. What the services did in the past was, it targeted the gyms as well as the nutritional food. So if you think about it, sometimes you want to hit the gym, but then you subscribe, but then you fail to go through your plan. So it's like one moment we can make you open your wallet, but it stops there. So that is why we have to make it sustainable, and the concept of health has to be sustainable, but it's not easy. So you talked about digital therapy. So because we have many non-experts from our audience, can you please elaborate on what digital therapeutics are? Well, they are drugs, like surgery drugs and treatment, and we provide it in a software manner. So it's an application that we offer to the users. For instance, for people having trouble sleeping, we can change their sleeping patterns as well as behaviors to improve health. So it's not just about improving health itself, but it serves as a therapy and therapeutics, and it receives approval from the authorities. So in the B2C area, it was not easy to succeed. So what happened before, it was the doctors, prescribing the drugs to the patients, and we want to retain that with our app so that it becomes more reliable and people can follow that through. For instance, we have PHR, the personal health content data, and we can connect all the different data together. For instance, once telemedicine becomes widely accessible, then sometimes people would have to go somewhere to get their drugs. So it can't be 100% telemedicine, but digital therapeutics, everything is done online. With source code and API, you can just download your prescription paper, and it can be delivered to your doorstep. So now, because we keep creating data on our app, we have much potential to link it to other services as well. So in a way, we have this huge platform, and it can be used in a different manners, and it can also serve as a standalone solution for the users.
저희 분야에서
Yes, digital therapy is really one of the most discussed topic, and it seems that a lot of people in our audience today are also interested in digital therapies. There are a lot of investments flowing into digital therapies, and also there are a lot of government initiatives on digital therapies. So there is a follow-up question to that. What are the pros and cons of digital therapies, and also what are the characteristics of its fee schedule? I think you already covered the pros. Are there any cons of digital therapy? And also in terms of the fee schedule, well, I mean, that could lead to endless discussions. But anyway, what do you think the fee schedule for digital therapy look like?
어려운 질문 죄송합니다. 네.
네, 그래서
Well, as you said, it has to be integrated into the healthcare sector. How do we make money? We, of course, it will be covered by the insurance companies. So what will happen is that for this it's 20,000. For this it's 4,000. All the prices are set. For instance, if you have like a C-section, then that price is set by the authorities. So it's not a free competition, free market. You have to claim the money. And so at the end of the day, it has to be reasonable, and you have to be able to persuade the insurance companies.
굉장히
Yes, the fees are an important topic, not just in terms of digital therapy, but across all the different areas of digital healthcare. And there are some things that are not so appropriate to be discussed in open forums, but we are working very hard across the board. So, and also a lot of the government agencies, I believe, are more forward-looking in terms of adopting digital therapies for the Korean people. And last but not least, Tua Che, I also want to ask you this question of what do you think is the most promising in digital healthcare? Well, I'd like to point to two things. Number one, there are innovations that can happen within existing digital healthcare services. And number two, there is a potential of convergence with other industries around the same focus of health, and that could lead to new opportunities. The first part that I talked about would involve the innovations in hospitals, pharmaceutical companies, and pharmacies. And in that context, we could maybe see a type of a hospital that's unprecedented, that we've never seen before, which provides telemedicine, and that could provide innovative experience. And the second premise that I mentioned was also related to innovations in pharmaceutical industry. DTX is actually one of the ways to innovate the pharmaceutical industry. And one of the keywords in pharmaceutical industry is, of course, distribution. Even if we have distribution, we have to think about how to prescribe the drugs, how to deliver the drugs. And there will be a lot of pressure on different actors on that front. So we have to maybe reevaluate the existing roles of the pharmacies in terms of delivering the medications that have been prescribed by the doctors. And I think there are already some innovative ideas about redefining this role. And the second promising part I mentioned was that health is something that is relevant to all industries, including finance, housing, education, and everything. All the industries are interested in health, and that's why I think that we will see faster innovation through convergence. For example, in the food and beverage sector, in the past, the businesses were only concerned about selling a lot of foods and beverages, but now people are becoming more health conscious. Consumers are now considering health much more in their purchase decisions of food and beverages. And so the food industry will also transform around this keyword of health. These days, a lot of people are increasing their intake of protein through foods or supplements, and I think this is just the beginning of a change. So yes, the food industry could change, and also there could be a convergence between healthcare and finance industry. And it doesn't just mean a financial company trying to sell more insurance products. It's more about truly understanding and identifying the needs of the users to make a decision making. This is what we call My Data project. And to this end, a lot of the financial companies are engaging with healthcare companies, especially digital healthcare companies. So I think My Data business is another area which holds great promise. Can I say my personal interests? Yes, of course. If I was given an opportunity to build another startup, and I was free to choose whatever item for my business, I would probably choose this. I think there are two ways to expand healthcare service. Number one is climate and health, climate and environment rather. I think healthcare is something that could be extended to the idea of environment and climate. And another item that I could consider is that the ultimate health management, I think, is the death management. What I mean is, how do you prepare for death? How do you manage your death? And how do you leave what you have to your descendants, so to speak? And I think that is basically the ultimate goal of health management. And I know that this would be relevant with a lot of different areas like philosophy and law and so on. And this is an area where we don't see a lot of innovation. And if digital innovation could also reach this business of death management, I think that could also be quite promising. Thank you. You gave us a lot of keywords that we can think about. So you said that there could be innovations within hospitals and pharmaceutical companies as well as pharmacies. And also you talked about the convergence across different industries around the focus of healthcare. And also you talked about some fascinating business items like the concept of well-dying and an opportunity for the finance sector. And I think that brings me to the next question. Dua Che, I would like you to maybe answer this first. Here's the third question. Where do you see Korea's digital healthcare industry in 10 years' time? Where will we be in 10 years' time? And to reach that point, what should we do? What do we need? You talked about the concept of well-dying, and you talked about the different industries that can become relevant to healthcare. So as we chart our path forward, what do we need, and where do you see ourselves in 10 years' time? So 10 years later would be 2031. When you look at the advancement of deep learning technology these days, it's almost scary because it's so fast. So we have definitely reached the critical point in technology and the turning point in technology. So in 10 years' time, I think we will be able to really address a lot of the problems that we face today using technology. And what we need to do is we have to imagine what can become possible. I think that's our roles of the panelists here. For the next 10 years, we will see unprecedented changes, like unprecedented hospitals, unprecedented pharmacies, and unprecedented hospices, and other unprecedented experience that we've never thought possible before. And to make that into reality, what should we do? Well, hardware technologies and software technologies are already there, I think. So let's assume that these technologies are already there. Our job is to dream what can become possible, what should become possible. And I think that is the role of the players in the market and in the field. From that point of view, you mentioned earlier about the relationship between big conglomerates and startups. And I think it will be a competition of who can dream better. So large conglomerates should also reorganize themselves so that they can dream better. From that point of view, if that's the rule of the game, I think startups are at a very advantageous position. In the past, if you wanted to do deep learning, you had to buy expensive computers that were not accessible. But now, everybody can use the computers to use deep learning. In the past, if you wanted to develop a game, only the large companies could do it. Now, the tools are available to everyone, so as long as you have great ideas, you can develop your own games. Likewise, that's what's gonna happen in the digital healthcare industry, in my opinion. So I think my role is really to dream big, and also it's important to create a society and a culture which promotes people to dream big. That was an inspiring answer as a visionary. And thinking about 10 years from now, you said that most of the technological barriers will disappear. You said that the software and hardware technologies will be available. It's more about how well we dream, how well we imagine. That, I think, is a lot of food for thought for everyone. Today we have this session of the experts and the professionals, but we should not be complacent. I mean, I think all the panelists here have been in this field for at least 10 years. We're kind of old bees rather than newbies, so we may have limitations in our imagination. So I think maybe the audience can provide us with the imaginative input and creative input. In Korea, we have this word called young blood. So I think we really need to acquire a lot of young talents to get inspired by them. And now, who would like to go next? Where do you see ourselves in 10 years' time?
인물이지만
Yes, I'm also an old bee, as you said, but I will unleash my imagination as much as possible. Anyways, I majored in psychiatry, so I'm very much interested in mental health, about my voice, the wearable devices, like everything surrounding me. So now let's say that your stress level is high, and then your car will shift to a relaxation mode, and your AI will receive the command to provide you with the right consulting and prescription. And with that, you will ride smoothly, turn the vehicle, on a self-riding mode. And now, let's say that, the signal is a very warning sign signal. Then you will make appointments with the doctor via telemedicine. And let's say that you're again struggling with panic attack. Then of course the doctor as well as the software will have the patient records, all the data, and based on that you will get prescription for your mental illness. And you will also have a distress program, at a premium rate to relax and wind down. Now, of course, it's not so much of technology hurdles, but the obstacles that we are faced with right now is how much trustworthy will the data be, and how much reliable will telemedicine be? And of course, the government will need to provide support. And we need to gain the trust from the public about this type of application. And I wished all the success for my data.
분이
Yes, because you're a psychiatrist, you talked about the different aspects of mental health and how technology could actually support the enhancement of mental health. Next, Youngin Kim, where do you see ourselves in 10 years' time? I was going to ask you that question actually, but actually, there is another question about how competitive Korea's digital healthcare would be in the global market. Noom is a global company, of course. So, in your opinion, do you think that where do you see Korea's digital healthcare in terms of competitiveness? And in 10 years' time, where do you see ourselves?
글로벌 말씀드리려고 했는데
Well, I wanted to talk about the global market, and you just asked that question. Anyway, we have our headquarters in the US, and I'm the country manager for Korea and Japan. And because of that position, I was able to identify the strength of Korea. I talked about the accessibility to IT, healthcare, and data. At the same time, speed is another strength that Korea has. So what I mean by that is speed of innovation. Because speed matters when it comes to the adoption of innovation. Let's say that for illnesses beyond losing weight, for cardiovascular patients as well as cancer patients, and the speed of service delivery is much faster than the US. So Korea can set the example for other countries, and that's what we actually do right now. So in 10 years time, so I don't want to be too rosy, so that people have too much expectations about Korea's healthcare. So I'm not saying that we can take our platform to the US and innovate and reform the US healthcare system. But when it comes to Southeast Asia and Japan, our neighboring country, then because we can overcome racial differences as well as other gaps more easily, I think that our experience, be it platform or data analysis or risk analysis, we can actually leverage that to export those capabilities to those specific countries that I just mentioned. And just like the semiconductor business, this is a sector with a high entry barrier, and because it's not dependent on how much investment you get. So K-Wave, I think it's now something of the past. We have to look into the future. But given its potential and promises, I think that we can go global. But if you are thinking of kicking off new startups on healthcare sector, you can't just go global overnight. You have to really be prepared. So even if you have, you operate the business in Korea only, for now, you have to look into the future in terms of the market size and scalability, because if you are too late, then you have to, create everything from scratch. So please make sure to be prepared. And in 10 years' time, I think that, be it Indonesia or other countries, a Korean company, healthcare company, can actually provide services to Indonesia. I think that's feasible. Yes, startups in Korea have a lot of potential, and they're growing fast, and the speed of growth is what matters. And in digital healthcare, we shouldn't just target advanced developed countries like the US or Europe, but also there is a lot of potential of working with Southeast Asian countries. Now, we're almost near the end of the session, but I did already address some of the questions that we got from the audience on YouTube, but in the remaining time, I would like to address some more of these questions.
Later, we will have a presentation by Newbase that will address your question about the relationship between metaverse and digital healthcare. And the reason why we have panelists from Noon Korea, AMED, and URA Positive is because they are really some of the representative companies in terms of digital healthcare in Korea. And I think what was really impressive during today's discussion is the message about how the competition is about dreaming well. And also, in order to create this future, what should the government do? What should the businesses do in order to shape the future? This could be a difficult question, but what do you think? The businesses, the government, and also the individuals, what do you think their role is? Especially if you think about the government, a lot of the governments suffer from lack of imagination. So what do you think the governments could do better?
아니면은 각자 본연
Well, you have to do your job. So, for instance, governments, they cannot, once if they try to provide the service, if they try to assume the role of the service provider, then everything will go wrong.
심판자
Yes, I think the government should basically play the role of maybe an umpire and maybe not compete with the private companies and leave it up to the private companies to innovate. And I have about 1 minute left. Is there any other comment from the other panelists? If not, we will conclude the session. I thought 1 hour would be quite long, but actually, because there were so many interesting things to talk about, the time flew by so quickly. And I hope that we were able to cover a lot of the questions from the audience as well. And I would like to once again thank Youngin Kim from Noon Korea, Sujin Kim from AMED, and Tua Che from URA Positive for joining us here today. I was Yoon Suk Che from Digital Healthcare Partners. Thank you. That was a session on the future of digital healthcare. In healthcare, there are different stakeholders with different perspectives, and we were able to see many different angles on these questions by having a good mix of the panelists with different specialties. And I hope this was a meaningful and inspiring session for you. Now, in addition to digital healthcare, digital data, digital metaverse, and all the other IT technologies are bringing a new future for all of us. And next, we have a special session where we will actually introduce some startups. Before we begin the special session, I have a housekeeping announcement. I know that we have a big audience on YouTube joining us online. And I would like to once again give you some information about the viewer event. In order to make this a more meaningful forum for you, we prepared a number of events. Before we start the special session, we will have real-time quiz event. On the screen, we will show you some questions. So please read the questions on the screen. And also, in the chat room, you will see the information on the quiz event. If you know the answer to the questions, please write the answer and then your name and then the phone number. We will receive your answers until we begin the special session with introduction of the panelists. We have a lot of prizes for the winners, and after the end of today's forum, we will also announce the winners for this event as well as other events. We also have a lucky draw at the end of the event.